Hello, Mitch Brock. How are you today?
Hello.
So, what's going on today?
Nothing much. I mean, I don't know. I'm just here to make sure nothing's wrong with me. I got a few symptoms of some things, and I just want to clear them up.
Okay. Let's take a look at your chart. Okay, how long have you been having these symptoms, such as the discharge, the anal pain, and bleeding?
Probably about a couple of weeks. I've been trying to ignore them because, I mean, I'm only having sex with my boyfriend, so I wouldn't think I need to be leery of these symptoms.
Okay, you always want to, be precautious because you never know what's out there. Guys can tell you one thing and do something total opposite, but that's besides the point. Are you guys using condoms?
No, not. I mean, like I said, it's just in our relationship, it's just us. So, no. I mean, we've been together for probably a couple of years, and we've never used any because I never thought we had to.
Okay. Is it, a choice that you both made not to use them, or is it just him, or is it just you?
Well, I mean, I can't put a condom on, right? So, like, if he doesn't want to, I love him, and he doesn't have to. If he doesn't, I wouldn't want to force someone I love to do something they don't want to do.
Okay. Well, the only way to prevent, some of these symptoms, because it kind of is sounding as if you might have a sexually transmitted disease. So we're going to actually go ahead and waive the fees and have you tested today for HIV, syphilis, chlamydia, and gonorrhea. And like I said, the fee will be totally waived, and we just want to help you and make sure we prescribe you the right medication. So, don't be scared. It's one of the most common STDs, between the age of 18 to 25. So we can get it taken care of, and we'll make you feel totally comfortable. So don't feel alone. We have stuff like this happen every day.
Are you sure? I mean, it's just us, he wouldn't.
Yes, I understand that, but you never know. I don't think, the symptoms you're having would be symptoms of you having a cold or allergies. It's something more serious, and the gonorrhea, and also known as the CLAP, is it's pretty common, and the symptoms are pretty similar, and if you weren't treated, you can have damage to your cervix, your uterus, your fallopian tubes, and your urethra. And this also, can travel to your throat, eyes, anus, and mouth. So, some of those damages will cause you to not be able to, produce children. And we want to make sure that that's not an issue, or you're actually able to have sex with your boyfriend and be comfortable and not have all this pain. Because the symptoms will get worse, and we don't want, the gonorrhea or the CLAP to form into anything bigger, such as HIV, because most of them, the sexually transmitted diseases, go on to something more.
So as for I don't know, should I? How soon can I have sex again?
Well, we're actually we're gonna get you tested. We'll only get the results from the HIV, syphilis, and the gonorrhea today. But as far as the chlamydia and the other two, we'll have to wait 2 weeks. But you will be prescribed medicine, if there is something wrong with you today. But it's best to not have sex at all until we get the results back in a week or two with the other possible STDs. And after that, if you were to have any other STD, you would have to be prescribed medicine. And with the gonorrhea and the chlamydia and a couple of the other two, it's simple pills you take once or twice a day, no drinking alcohol, no sex, and then you have to come back. After the pills are gone, we'll give them to you for 7 days. You come back, we'll check, see if you're still having symptoms and stuff like that. And if you're okay, then you will be able to have sex again. but we would want you guys to be more safe and precautious, use condoms, and I know you love your boyfriend, I'm sure he loves you too, but you guys, you guys have to use condoms so you don't run into this again.
Well, maybe it's not from my boyfriend. Maybe I got it from like a toilet seat, or I did share a bath towel with my sister the other day, or like, is it possible I could have gotten it from someone else besides? Because I mean, we are in a relationship where it's just him and I don't believe that he gave it. Can I get it from someone else?
Well, actually, as far as gonorrhea and herpes, yes, you can get that from sharing towels or, any, maybe underwear. I doubt you share underwear, but, simple as a swimsuit bottom.
I'm sorry.
You can, if they are treated, if they are not treated, if they are, infected with the gonorrhea or the herpes, then, and you use their towel, then yes, that is the way, and the most common way besides actual sexual intercourse to get the disease. So we can also, if you're comfortable with telling whoever you use towel or, borrow something from, that it's important they get tested, because we don't want, we want to break this down, because it's one of the most common STDs, and it's very preventable, and it's treatable too. So a lot of people get scared and think, oh, I'll never be able to have sex again, or oh, my partner's going to be bad, but you guys, you'll be fine. Everyone will be fine as long as you guys get treated. And if you ever feel any symptom that, you're not used to, your body, so you can always come here. This clinic is in your tuition. It's free from your school, as long as you come with your school ID, and you won't have to worry about anything. And everything is confidential.
So as far as like, because I mean, if I am positive for a lot of things that you're talking about, the clap or whatever, how do I go about getting him treated?
He definitely is going to have to get treated, since he is the only one you're having sex with, and you just got the symptoms. Usually for the herpes and gonorrhea and chlamydia, it can take anywhere from 2 days to 21 days for the symptoms to show. And you said you've been feeling like this for about a week? Yeah, so we definitely would want him to come in as soon as he can and get him tested, get him prescribed if he needs something.
But he doesn't really like doctors, so like, is there something I could give him, or he has to come in?
Yes, he absolutely has to come in, because we will have to draw blood from him for the HIV test, get swab his mouth for the chlamydia, and we'd have to go from there. So yes, he would definitely need to come in. And is he a student as well? Okay, so yeah, this is no cost. The testing for all these, these STDs can range from anywhere up to $200. And we know as students, and being young and maybe not feeling comfortable talking to your parents, it's confidential. Like I said, if you want to tell them or they want information, we can give it to them, but not without your authority.
Okay. Well.
So we can send you in to the nurse, and she's gonna just have you put on. You can just take your pants off and put on the little skirt thing, and she'll come check you. And if you have any other questions, you can just ask her. And she's a nice lady, so you should be fine. And then after she does that, you just wait about 30 minutes, and your results will be ready.
Okay.
Are you okay? Are you nervous?
I'm very nervous. I've never had anything wrong with me before, so I'm very nervous, and I don't know what to feel, because I'm in love with someone who has made me feel this way, and I don't know.
Yeah, I understand, but we're here for you. I'm sure you have supportive friends and family, and you can always come back and talk to me. I have an open office, and I have a lot of books and stuff. Whatever you want to know, we can go over. I just want all my patients to feel comfortable.
Thanks, Todd.